Today, when we think of psychiatry, a few things probably come to mind: diagnosis, medication, cognitive behavioral therapy, and maybe a 15-minute med check. But tucked away in the history and still quietly alive in practice is a different tradition, a deeper one, a slower one that listens not just to what you say, but how you say it, and why you might be saying it that way at all. It's called psychodynamic psychiatry. In this video, we'll explore what psychodynamic psychiatry actually is, where it came from, how it differs from other approaches, what kinds of patients it helps, and why it might be time for a comeback. Let's take a look at this often overlooked, but still vital, form of psychiatric care. So, what is psychodynamic psychiatry? At its core, psychodynamic psychiatry is an approach that emphasizes the unconscious mind, early life experiences, and interpersonal relationships as key forces shaping our emotions, thoughts, and behaviors. It's rooted in the idea that much of our mental life happens below the surface, and that by exploring these deeper layers, we can better understand ourselves, our suffering, and our patterns. It's not just about symptom control, it's about meaning, about insight, about the story behind the symptoms. A quick history. From Freud to the present, psychodynamic psychiatry traces its roots to Sigmund Freud and psychoanalysis in the late 19th and early 20th century. Freud introduced the world to ideas like the unconscious defense mechanisms, repression transference, childhood shaping the adult self. Over the decades, many schools evolved from Freud's original ideas, like Jungian, Adlerian, object relations, self-psychology, and more. Eventually, psychodynamic therapy emerged as a more accessible, flexible version of full psychoanalysis, shorter, more focused, and often integrated with medical care. And psychodynamic psychiatry became the branch of psychiatry that uses this lens, not just for therapy, but for understanding diagnosis, medication, and treatment planning. How is it different from other psychiatric approaches? Let's contrast psychodynamic psychiatry with more common approaches today, like biological psychiatry or cognitive behavioral therapy, CBT. Biological psychiatry focuses on brain chemistry, neurotransmitters, and genetics, uses medications to adjust neurobiology. Goal: symptom relief, strengths: fast symptom reduction, especially for acute illness. Limitations: doesn't address root causes or personal meaning. Cognitive behavioral therapy, CBT, focuses on thoughts and behaviors, helps people challenge distorted thinking and develop coping strategies. Goal: functionality and symptom management. Strengths: structured, evidence-based, short-term limitations, may overlook emotional depth and unconscious processes. Psychodynamic psychiatry focuses on unconscious motives, emotional conflicts, relational patterns, and meaning. Explores how the past lives in the present. Goal: insight, emotional growth, deeper change. Strengths: holistic understanding of the person. Limitations: takes time, can be emotionally intense, and less structured. So while CBT asks, what are your thoughts and how can we change them? Psychodynamic psychiatry asks, where do these thoughts come from? What emotional truths do they reflect or defend against? It's not better or worse, just different. The core concepts of psychodynamic psychiatry. Let's unpack a few key ideas. 1. The unconscious mind. We are not fully aware of all our motivations. Some emotions, fears, and desires operate outside conscious awareness, yet still shape our behavior. Psychodynamic psychiatry tries to bring those hidden dynamics into the light. 2. Defense mechanisms. We all use defenses to protect ourselves from painful feelings. These might include denial, projection, rationalization, displacement, intellectualization. Recognizing these patterns helps patients understand how they cope and at what cost. 3. Transference and countertransference. Transference: when a patient unconsciously redirects feelings from past relationships onto the therapist or psychiatrist. Countertransference: the clinician's own emotional reactions to the patient, which can be clues to what the patient evokes in others. These are not obstacles, they're diagnostic tools. 4. Developmental history. Psychodynamic psychiatry pays close attention to childhood experiences, attachment styles, family dynamics, identity formation, because how we relate now often mirrors how we learned to relate early on. 5. The therapeutic relationship as a mirror. The interaction between psychiatrist and patient is itself a reflection of internal dynamics. How a person talks, avoids, idealizes, withdraws, or pleases, it all tells a story. That story is often more revealing than the symptoms themselves. What does a psychodynamic psychiatric session look like? It might surprise you. It's not always lying on a couch talking about your dreams, though sometimes it is. In most cases, it's a thoughtful, exploratory conversation, less structured than CBT, guided by curiosity rather than worksheets. The psychiatrist is active but reflective. There's space for silence, emotion, and meaning-making. The patient is invited to notice patterns, connect feelings, and develop insight at their own pace. When is psychodynamic psychiatry especially helpful? This approach shines when treating personality disorders, chronic depression or anxiety, psychosomatic disorders, trauma survivors, relational problems, identity struggles. It's also helpful for patients who feel stuck despite meds or CBT, want deeper self-understanding, value insight as part of healing, have emotional issues tied to past experiences. Of course, it's not for everyone. Some people need quick symptom relief, crisis stabilization, or prefer structured tools. But for those who are ready, it can be transformative. What about medication? Psychodynamic psychiatrists do prescribe medications, but they consider more than just the symptoms. They ask, what does this medication mean to the patient? Does accepting meds feel like weakness or relief? How does the patient relate to the psychiatrist prescribing it? They don't just give pills, they explore the emotional layers around them. That's what makes the approach holistic. Why did psychodynamic psychiatry fall out of favor? Several reasons. The rise of biological psychiatry and the chemical imbalance narrative, insurance companies favoring short-term, manualized treatments, pressure for productivity, and brief med checks, misconceptions that it's outdated, elitist, or unscientific. Lack of standardized outcome measures. But more recently, there's been a renewed interest. Why it's making a comeback. We're realizing that quick fixes don't always work. Medications help, but they don't heal wounds of meaning, identity, or self-worth. And many patients are craving deeper conversations, not just symptom checklists. Psychodynamic therapy is gaining ground again, especially when integrated with other treatments, informed by neuroscience and attachment research, tailored to modern settings, including brief or focused psychodynamic therapy. There's also growing recognition that emotional insight changes the brain, not just meds. Final thoughts. Rediscovering the depth. Psychodynamic psychiatry may not be trendy, it may not be flashy. It takes time, patience, and a willingness to sit with complexity. But in a world of quick answers and 15-minute appointments, it offers something rare, a chance to be deeply understood. To uncover the roots beneath the symptoms, to transform suffering into meaning, to reclaim agency through self-awareness. It reminds us that healing isn't just about control, it's about connection to ourselves, to our past, to another human being bearing witness. And maybe that's not outdated at all. Maybe it's exactly what we need right now. If you found this video thought-provoking, hit like, subscribe, and share it with anyone curious about the deeper layers of psychiatry. Drop a comment. Have you ever experienced psychodynamic therapy, or do you practice it yourself? Until next time, take care of your mind and don't be afraid to look beneath the surface.